So we have today back to back two anatomy lectures to finish off the anatomy content of the head and neck and the developmental residue that we had. Now first hour we will cover this embryological topic of the development of the face, palate and the nose, and in the next hour we will cover this palate, the gross anatomy of the palate. So this is the plan for the day for these 2 hours that we are going to cover. Now, so coming to this particular development of this particular face, neck and head region, we learned about this particular concept of this pharyngeal apparatus. Now we are going to talk about this particular development of this particular face and the errors of the face. Now this particular errors in the face become significant because number of cases of developmental error that surfaces the clinic, which is one of these is this error. We call them as cleft lip, and this particular cleft lip, if you probe deep, you see that there may be associated with the cleft palate. That means this particular deficiencies, whichever is visible on the lip, which is extended to the palate as well. So this particular cleft lip and the cleft palate is the number one clinically presented developmental error. Though the developmental error of the cardiac issues are more frequent, but they present to our clinic less in number than that of face, because the facial errors are often recognized earlier than that of cardiac errors. That's the reason. But this particular facial errors that we have may have this particular problem with the lips and may have the problem with the development of the error of these particular palate errors. So this is the reason for what we are going to study back here. We are going to study about this particular development of the face. Now the story of the development of face is complex. Now we do not want to just like make things like look like ugly, but we have to understand basic 3 principles of the development of the face. And in development of face, we are going to talk about the developmental lip. We have 2 lips, upper lip and lower lip. We have to understand what are the different parts of the lip we have and how this particular different part of the lip is there. What are this particular part which contributes the formation of the cheek, and this particular facial or upper face and the lower face, which is the lower regions of the cheek, which is known as the jaw region. Now this is what we see that in the early phase of development, around 4 week, 5 week of developing embryo, and this particular midline cleft we are seeing here, we call them as stomodium, this future mouth that we are going to eat through in the future days. This is we call them as stomodium. Now around the stomodium we have some prominences appear. One prominence present in the midline frontal region, one prominence present on the right side, left side like this. Now this right and left prominences, which is easy for us to remember because they are known as maxillary prominence, which are marked with this particular orange color shade. We call them as maxillary prominence of the right side and maxillary prominence of the left side. The lower one which is seeing here, these 2 other prominence, other side, we call them as mandibular prominence. This right side mandibular prominence, left side mandibular prominence. These are the 2 prominence which is present. And this one which is present over here in the midline, we call them as frontonasal prominence. Now these 3 prominences, right side, left side and the midline around the stomodium, creates this particular future face region that we are going to develop in. Now first we are going to talk about the development of the lip region. So before we go understand this, we have to understand these different parts of the lip, which makes us easy to understand the developmental part. So if you are looking at this particular anatomy of the lip, this midline portions of the upper lip, we call them as philtrum. So this particular philtrum is the midline part of the upper lip, and these sides we call them as vermilion borders, or the bodies of the lip. Right side vermilion border, left side vermilion borders. Lower lip also have the same thing, which is united together with the vermilion borders, right and left. There have intervening tissues in between. Likewise this particular upper lip. So upper lip have got 3 components, right? Vermilion border, left vermilion border, intervened by this midline tissue. We call them as philtrum. That's why we have this particular entity which is different that of the lower lip. Lower lip only have vermilion borders, right and left fused. We do not have any fusion mark there. Now as we are going to learn the development of the upper lip, these portions we call them as philtrum develops from a different source than that of these vermilion borders. Now these three sources coming together and meeting in a point makes this particular upper lip prone to have developmental error. If you have any kind of problem in the mingling of the tissues where from this philtrum is developing, where from the vermilion borders is coming, we have this error, we call them as cleft lip. So this cleft lip comes as an exam short note that you have to understand or that you have to answer that in exams. So this is what we are starting again. So development of the face region starts with this particular 3rd week, 4th week of life with 3 prominences. We call them as frontonasal, midline prominence, then maxillary and mandible. We have the 2 color shades, maxillary, this one orange, and the mandibular, which is having this particular red color shade. Now this particular frontonasal, as you can understand, the midline part we call them as frontal process, and this lateral part we call them as nasal process. This nasal process, right side, left side, forms like a button like swelling. We call them as placode. Now this placode we call them as nasal placode. Now within this central of the nasal placode, there develops a depression. We call them as nasal pit. The nasal pit depression elongates and forms this nasal cavity, which is going to form the future nasal cavity for us. Now this particular, around this particular pit or this nasal pit, we have this raised margin of this particular nasal placode. We call them as 2 parts, right side and left side. The medial one, which you are seeing here in the green, we call them as medial nasal prominences, which is present in this side is marked as green, and this purple one we call them as a lateral nasal prominence. So again we start with this nasal placode which has a central pit, and the central pit makes a depression, making this margin raised up as prominences, medial prominences, lateral prominences. Medial one we call them as medial nasal prominences, lateral one we call them as lateral nasal prominences. For each of this particular component give rise to different parts of this particular upper lip. Now this particular medial nasal prominence in green comes in the midline and unites together and forms an intermingling tissue. We call this intermingling tissue as, we call this joining of this particular tissue is intramaxillary process. So this particular 2 tissues joins in the midline forms this intramaxillary process. Now this particular intramaxillary process yields 3 tissues from here, 1, 2 and 3. The midline one forms this philtrum that we talked about upper lip. It forms the front 4 incisor teeth. And it forms a part of the palate. We call them as primary palate. So this particular intermaxillary process for coming from the right and left medial nasal prominence. So if you have error in the movement of these 2 right side and left side green bodies, we may have error, as well as if we have this particular error in the green body association with other tissues, we have this particular problem. So we get these 2 form of tissues at union of this particular green bodies. We call them as intermaxillary process or prominence. Now intermaxillary prominence over here reaches over this particular point, makes this particular philtrum part of this upper lip. Now this particular tissue which is present on this particular lower margin, which is known as maxillary process, this maxillary process grows in the midline, right side, left side, and eventually meets with this particular intermaxillary process or this medial nasal prominences and fuses. Now this particular fusion of this particular green body and this particular orange body creates this particular lips. Now again, if you just like see this particular picture of the lip, the philtrum part is formed by this green tissue. The philtrum part of the upper lip this one is formed by the green tissue. That green tissue we call them as fused intermaxillary process, this part. Now this vermilion border, right side and the left side, is formed by the fusion of the maxillary prominence. So right side maxillary prominence, left side maxillary prominence, this orange tissues makes this particular vermilion border of the upper lip. So this is how this particular part is formed. Now, if we have an error of this movement of the maxillary process of the right side or left side or this particular intermaxillary process, we have a deficiency. We call them as cleft lip of the right side, left side. That's what we are clinically developing in. So this is what we have to understand regard to answering the error, what we call them as cleft lip deficiencies. So if you get a clinical problem like the cleft lip error, they have to understand this particular anatomy or embryological anatomy of this formative error. So formation error of this particular problem will be there if this particular two medial nasal prominence, right side and left side, forms this intermaxillary process, mingles with this or merges with this maxillary prominence, forms this upper lip, vermilion border, and this particular philtrum fails to unite, we have this particular lip problem, we call them as cleft lip. Now, similar to that, the lower lip is formed by this particular mandibular prominence. Right side mandibular prominence, left side mandibular prominence fusions over here and forms this lower lip and the jaw region. Now, prominence on this particular mandibular region do not have any intervening tissues. That's why the error of the lower lip cleft is less than that of upper lip. That's what also the question comes here. Why this upper lip cleft lip is more common than that of lower lip cleft problems. So you have to explain it because of this particular intervening tissues which is making this particular lip, upper lip is coming from this particular intermaxillary process and the fusions of this maxillary prominence. In case of three tissues coming over here, make this particular union troublesome than that of lower lip formation, which is formed by the union of the right mandibular prominence and left mandibular prominence. So this is how this particular lip is formed in the subject in the normal developing process. So that's what we are going to talk about, development of the lip, upper lip and lower lip. Lower lip is easy in a sense, or for developmental reason, mandibular prominence, right side and left side comes together, forms the lower lip. Upper lip forms from two sources, right side maxillary prominence, left side maxillary prominence forms this particular vermilion border of the lip, and the middle portion we call them as philtrum, formed by the union of the two medial nasal prominence, which is known as this particular intermaxillary process or intermaxillary body, which is forming here. So if we have error in the movement of the maxillary prominence, right side, left side, or this particular intermaxillary process, we have a cleft lip likely to be formed as a developmental error. So development of the lip is really common in terms of the clinical problem that you see. Next part is easy in terms of development of the nose. Nose is developing from this particular nasal placode, as I have seen. This particular nose, we have these different parts, like we have this particular nasal cavity formed by the enlargement of this particular pit. We call them as nasal pit. Right side nasal pit, left side nasal pit fuses in the midline, and then this particular fused midline part grows inside and forms this particular future nose that we have. Now, nose have got few parts. This part of the nose where it touches the forehead, we call them as the root, we call them as this particular part as a root of this particular nose. Then this part where it is touching this particular point, we call them as tip of the nose, and in between we have the body of the nose. Now this part we call them as root of the nose, forms from this frontonasal or frontal process. And then we have this particular nose which we call them as this particular medial nasal placode, medial nasal prominence, right side, left side, unite together, forms this particular rest part of the nose from this particular root to tip and as well as septum. Now this lateral part we call them as ala of the nose is formed by this particular purple person or purple element, which is known as the lateral nasal prominence. So nose as such is contributed by these particular three processes or three elements: frontonasal prominence, medial nasal prominence which is splitting into, and lateral nasal process, right side, left side. They are making inside to it, joining together makes this part. So nose, in this particular root of the nose, which is the part of the nose which is touching the forehead over here is formed by this particular frontal process. Rest is formed by this particular medial nasal process which is coming from this root to this tip, and as well as the septum which is coming from this union of this particular medial nasal prominence. The ala of the nose is formed by this particular purple portions or purple element which is known as this lateral nasal prominence. So, this is what we are talking about the nose, and this nasal cavity is formed by the enlargement of this particular pit, we call them as nasal pit, right side and left side forms together and makes this particular dip. Coming from this nose, we have an expansions of the nasal cavity, we call them as paranasal sinuses. That means we may have the maxillary sinuses, etc., etc. So, this particular nasal cavity which is formed from this nasal pit which is uniting together forms on the lateral wall of the nose or nasal cavity and grows into the intervening bones and creates this particular outpouch from the midline, and eventually it grows in the bone and forms this particular sinuses. So, this nasal cavity grows into this particular surrounding or neighborhood bones and creates this particular surrounding paranasal sinuses. The paranasal sinuses, we name it as it is growing in the bones, frontal sinus, ethmoid sinus, maxillary sinus, it is there. Now, only thing that we have to keep in mind, the sinus we are developed with is the maxillary sinus. So, when we are born, we only had this maxillary sinus developed. Rest of the sinus is developed as we are growing with the age, crying, shouting and creating voices. This rest of this particular nasal sinus like frontal sinus, ethmoidal sinus, etc., are created. So, this maxillary sinus is only sinus, the largest of all paranasal sinus that we are born with. This is the MCQ questions that we see sometimes coming with the first sinus to develop is like that. Now, coming from these paranasal sinuses, we are going to talk about the last entity of this day is known as this palate. As we have mentioned, this particular palate needs little bit elaboration because palate also comes with the cleft defect which is known as cleft palate. Now, palate developmentally can be divided into two parts. Anterior part we call them as primary palate. Secondary part we call them as secondary palate or secondary palatal shapes, which is shaded by these two colors. So, we see that this part we have this gray line and this one is the black line. So, this is we are talking about the development of the hard palate. So, hard palate is having two parts, primary part and secondary part. Primary part is triangular part and this black one is the secondary part. Now, we focus on this particular primary part which you already know here. Now, this particular primary part along with these four teeth, 1, 2, 3, 4, these are known as incisor teeth. So, this particular four teeth along with this particular small strip of bony palate, we call them as the primary palate develops from this intermaxillary process. So, what is intermaxillary process? Again, which is fusion of this fusion of these two nasal prominences, medial nasal prominences, right and left fuses, creates this particular intermaxillary process. That intermaxillary process creates the philtrum, creates this particular four incisor teeth, and this particular part we call them as primary palate. So, this primary palate is developed from the intermaxillary process. So, this particular intermaxillary process is creating this primary palate along with these four incisor teeth and along with the philtrum part of the upper lip that we have learned. Now, this secondary palate which develops from that particular part which is posterior to this line. If you look into this particular palate, its side, we have a foramen there, we call them as incisor foramen. So, this particular incisor foramen anterior to it, we call them as primary palate, which is a very small narrow strip of tissue. Posterior to it, we have the bony palate, rest of the palate, which is a large bulksome part of the palate. Now, secondary palate develops from two sources. Again, if you go back to this particular development of this particular palate, where comes with this other facial element comes in play whenever this particular development of the secondary palate comes here. So, we have these two prominences right side and left side coming here around the stomodium. We call them as maxillary prominence and mandibular prominence. Now this maxillary prominence we have seen coming together, meeting with this particular intermaxillary process, making this vermilion border right side and left side of the lip. That's how this particular upper lip is formed between this particular region. Now besides forming this particular vermilion border of the lip, this maxillary process also creates a bony shelf. We call them as palatine shelves, which is forming in here, right side, left side. So this particular palatine shelves are coming from the developmental process. We call them as the maxillary prominence ingrowing. So this maxillary prominence, right side, left side, as it is coming close to the midline to meet this intermaxillary process, grows inside and grows to midline over here and eventually meet over here. So this particular palatine shelves created from this element, we call them as maxillary prominence, right side and maxillary prominence of left side. They, with time, they grow in the midline, they fuse with this particular intermaxillary segment, which is going to form this primary palate with the 4 incisor teeth, and makes this particular fusion together docked completely. And after this docking of these particular 3 elements, there are no line of marking or no union pleasure. So this is how this particular palate is formed in the definitive regions or definitive palate or secondary palate. So this particular palate comes from 2 sources, primary and secondary. Secondary one develops from these bulging out tissue, we call them as palatine shelves. Palatine shelves is coming from maxillary prominence. That's the word that we have to keep in mind. Now, if this maxillary process, right side and left side, it should be encroaching each other and docking with each other. If it is fails to dock with each other, there may be a gap present in between. That leaves this particular gap with the name of cleft palate. So that's what we have to answer in this particular clinical questions. So again, primary palate, we understand that, and secondary palate, how it is formed, we understand these fusions of this particular thing together, intermaxillary segment and palatine shelf. Palatine shelf is the word that you have to keep in mind, which is coming from the maxillary prominence. That's a word about the development of the definitive palate or the secondary palate. Now coming to this particular clinical problem, that's what you have to answer in clinical life or in an exam questions. So this particular problem comes with this cleft lip and cleft palate. So you have to understand this particular cleft lip, cleft palate. Why this particular cleft in the lips are happening? That's the first thing. Second, which lip is more commonly or more frequently having this lip cleft error? So upper lip or lower lip, and you have to justify it why. Now, the cleft lip may be in the midline, which is maybe present in the philtrum, or maybe on the side, which is present on the lateral cleft lip. So the locations of the lip cleft is may be present in the strictly in the midline or maybe on the mid away from midline. So looking at the philtrum, we are making this. If the philtrum is deficiently formed, that means this intermaxillary process is not formed. That means in case of the median cleft lip, we have this medial nasal prominence left side, which makes this particular intermaxillary process or segment is faulty form. If we have the lateral cleft lip, that means this medial nasal prominence, which makes this intermaxillary process is formed, but this particular maxillary prominence of the right side and the left side fails to meet with this intermaxillary prominence and creating this particular lip error. So lateral cleft lip, medial cleft lip. So you have to answer that or give a short account of the cleft lip error with embryological explanation. So you have to mention that there are 2 types of cleft lip error. You have to mention how this particular lip develops, upper lip and lower lip, why this upper lip is more prone to have cleft lip error than that of lower lip, and if you have this particular cleft lip in the upper part, what are the 2 varieties like median and the lateral cleft lip, and what forms this medial cleft lip error, what forms a lateral cleft lip error. Likewise, we have other problem with this same thing about cleft palate. So if you have this particular cleft palate, which is you are seeing that you have to ask the patient to open the mouth, and you may be seeing this particular cleft palate error. It may be partial, it may be complete throughout. So if you have this particular problem with the palatine shelves, that means this particular maxillary prominence of the right side, maxillary prominence of the left side failing to meet in the midline partially or completely, leading to this particular cleft lip. And if you have the cleft lip, the posterior part of the palate, which is known as soft palate, may also be faultily formed that lead to this particular cleft uvula. So, this particular cleft problem, which may be just like an error of the secondary or the definitive palate that may happen, lacks over here is a docking error of the palatine shelves, which lacks this particular, forms this particular gap in between over this particular problem. Now, if you have this particular error, what wrong with it? It is cosmetic defect, that's for sure. Other thing, whenever the patient is taking the food above this particular palate, we have the nose. That means the food particle may end up into the nasal cavity, which is the leading to this particular person to choke or aspirate. So, that particular persons who have this particular errors has a trouble in chewing the food, swallowing the food, and as well as regurgitations is a common problem. Infections is likely a problem with these particular regions, and as well as they have the error in the teeth formations as well. If you have this particular thing falsely formed, they may have the faulty formations of the incisor teeth, as well as this particular teeth may be like in erroneous in positions. So, this is what we have to understand related to this cleft lip, cleft palate. We have to understand what is cleft lip, what is cleft palate, and how this particular cleft palate and cleft lip happens to us, which is like happening in the frequencies like individuals. Now, coming to this particular, why this particular error is happening, it's a multifactorial things. It may be genetic error, it may be environmental, it may be related to some medicines, etc., etc. It's called a multifactorial error. But in anatomy, we ask you about to narrate about this particular logic of embryological basis of this cleft lip, cleft error or cleft palate error. What is the embryological deficiencies that is happening? That's what they are seeking if they are asking questions in anatomy about cleft lip, cleft palate. Apart from that, we may have some kind of other grave errors where we have the problem with this particular nasal cavity and this particular facial defects. We call them as facial cleft. You can see this particular person have got cleft which is extending from the lateral part of the face, extending up to this particular lip, and this particular thing is moving to this particular lip, the lower eyelid as well. So, where you have this particular thing which is deficiency of the fusions of this particular medial nasal prominence and the lateral nasal prominence not meeting in this side and creating a cleft throughout in the face. We call them as oblique facial cleft, right side, left side likewise. So, these are the few errors in this particular developmental problems with this particular palate and this particular lip and the face region. Prepare this particular cleft lip, cleft palate as developmental error or embryological basis of it. So, that is for this particular development of the face and this particular error which is related to this particular head and neck regions. It covers up and sums up all these problems which is related to it. So, we will come back again after a break at 10 o'clock for the understanding about this particular palate, which I believe is the only last thing that we are left in the neck region to discuss. Again, that part is already covered in the practical as well. So, in the theoretical little discussions about the palate, muscles of the palate, it will take 20 minutes to cover that particular content as well in the second part, which is coming around 10. So, you can take a break, come back after 10 if you wish to. Now, we have seen this particular palate can be divided off into two parts, and clearly which is hard palate or bony palate. Posteriorly, it is made of muscles covered by the mucosa which is hanging down with the aponeurosis which is holding that. We call that part as soft palate. So, this particular palate consisting of two elements, hard palate and soft palate. Hard palate, we just talked about the formations or embryological aspects of the palate like primary palate, secondary palate or definitive palate, and the soft palate which is hanging like a curtain from this particular front palate. We are going to talk about more detail about that palate than that of hard palate. So, just like to briefly talk about the hard palate, which is the anterior part of the palate which is present between this particular nasal cavity and the mouth or oral cavity. It is a partition between this particular oral cavity and the nasal cavity, And as you can understand, this particular is the partition of the hard palate is not formed in terms of like a cleft palate. We have a communication between the nasal cavity with the oral cavity that can lead to many problems that we have already have discussed. Now, this particular hard palate is formed by this particular bony part. We call them as maxilla. We call them as palatine bone or palatine process of maxilla. And then we have another process. We call them as horizontal plate of the palatine bone. This horizontal plate of the palatine bone, right side, left side, which we call them as palatal slave in case of this particular embryology, coming from the maxillary process. Now, this part we are familiar with whenever you are flipping this particular palate, seeing this particular tooth sockets are there, and this part we call them as this hard palate. This foramen in the front and in this particular midline we call them as incisive foramen or foramina incisura, which is the part, if you just like to draw a triangle from here covering this 1, 2, 3, 4 of these inside the tooth, we take this particular part as primary palate and rest is the definitive palate or the secondary palate. This part is developing from a different source and this part is developing from the different sources. So, incisive foramen which is present in this particular region, whenever you are seeing this particular skull or specimen of the skull, you can see this particular incisive foramen, which transmitting through this particular foramen is the canal and the nerves and the arteries, which is incisive branch of maxillary artery which is going through this particular foramen, and branch of nasopalatine nerves which is running through this particular foramens. Now, this particular entire region is covered by a mucosa. We call them as masticary mucosa, which you can see that it has a rugy or kind of like roughness there, which is tightly adherent to this particular undersurface of this particular palate. And we can see this mucosal ridge around this particular presence of this particular like tooth sockets or beyond that part as well. So, this particular mucosa which is present in here is keratinized and squamous because they have a number of friction which is taking place in this region because of the food particle grinds in this oral cavity, and this mucosa over here is partly keratinized and it is squamous variety of course, which is present in layer. We call them as keratinized stratified squamous layer, which is present, may be seen in this region. Otherwise, keratinization may not be there, present there. So, may be keratinized or may be partially keratinized or non-keratinized stratified squamous epithelium is covering this particular palate from the interior side. Now, if you see this particular palate from the other side or other side, that means from the nasal cavity side, that is lined by different mucosa or mucosa of the nasal cavity, which is nasal mucosa, which is covering that. Coming to this blood supply and lymphatic drainage of this small tiny anterior hard palate side is coming from these palatine branches of maxillary artery and greater palatine arteries. So, these are the two branches of the arteries which is feeding this particular area of the palate, draining to this pterygoid venous plexus, which is present deep inside this particular pterygoid bone of the sphenoid, pterygoid lateral plate, medial plate. In between their region we have the pterygoid venous plexus, which is draining this particular blood from the palate or hard palate. Lymphatics from here draining to this particular pharyngeal group of lymph nodes, which is deep cervical entity which is there. That means they are present around or surround this particular internal jugular vein in the neck region. So, this is how this particular hard palate can be described of. Easy to comprehend about this particular hard palate. Now, interesting facts about this particular hard palate is this part is formed by the bone, palatine bone and maxilla, and foramen, incisive foramen. I would recommend to emphasize this incisive foramen. There are several other foramens, tiny of them are there, many of them, but incisive foramen is a definitive one, helps us to identify the palatal development from the anterior and the posterior part of the palate or hard palate. Moving from this hard palate, the today's point we call them a soft palate. So, the soft palate is that part which is beyond the hard palate, hanging down to this particular part of the oral cavity with the curtain like structure hanging in between, we call them as uvula. So, soft palate with uvula, which is this particular palate is formed. So, it has got two surfaces, we call them as anterior surface, oral surface, or posterior surface, nasal surface. It has got two borders, superior border and inferior border likewise, and uvula which is hanging in the midline conical projections. It is kind of like thing which is visible once you open the mouth and say this particular muscle can be seen which is contracting and pulling this particular curtain up Now this particular soft palate have got two arches there which you have to appreciate. One arch is coming from the soft palate to the tongue, we call them as palatoglossal arch. Second palate arch which is present from palate to this pharynx, we call them as palatopharyngeal arch. These two arch you have to identify in your specimen, and in the cadavers if it is split open to the oral cavity, these two arches makes a lot for identification. Yeah. Ask the questions about these particular arches in anatomy. So, palatoglossal arch and palatopharyngeal arch, they hold a muscle into this particular arch, we call them as palatopharyngeus muscle. They hold a muscle into palatopharyngeal and palatoglossus muscle. These two muscles are present deep to this particular folds. Where these particular folds are there? On the lateral extremes of this palate. So, this is the oral cavity that we are seeing here. Midline is the uvula. If you go to the sides, you find the two ridges there, anterior one and posterior one. This anterior ridge is coming from palate to the tongue, we call them as palatoglossal arch. It holds a muscle, we call them as palatoglossus, palatoglossy. Posterior to that, we find another arch which is coming from the soft palate to this particular part which is going down to the pharynx. We call them as palatopharyngeal arch. In between these two palatoglossal arch and palatopharyngeal arch, we have a space there. We call them as tonsillar fossa or tonsillar bed. So, involving these two arch and this tonsillar bed, we have a number of questions to address in this particular region, which is need to be taken care whenever you are studying. So, palatoglossal arch, what does it mean? Palatopharyngeal arch, what does it mean? What muscle it contained and what the significance between this space which is lying between them. Now, coming from this palatoglossal arch to palatoflossals. So, this is what the external features that is present inside to it. Coming to the muscles which is present to this particular palate. We have a number of muscles, we call them as 5 pairs of the muscles which is coming to the palate. Some of the palate are enteric muscles within the palate, some of the muscles are coming to tongue to pharynx. So, because of this particular muscles are coming from the different regions, we call these muscles as different names like palatoglossus muscle, that means is coming to palate and ending on the tongue. Palatopharyngeus, that is where you mentioned palate to pharynx, these are extrinsic kind of muscle that is going on. The musculi uvuli, that means is present in the midline with the uvula, which is present in the musculi uvuli regions. Apart from that, we have this levator valli palatini. This is the muscle which is elevating the soft palate. It is contracting and pulling this particular palate up or soft palate up. This is the key muscle in case of the swallowing or deglutitions. And tensor valli palatini. This is making this particular palate become tensor or stretched whenever it is contracting. That is tensioning or making this particular soft palate to fly or to zoom up. What this particular tensor valli palatini and levator valli palatini is doing? This muscle contracting when you are swallowing. When you are swallowing, this soft palate contracts and makes the flap wider and move back. So, that means it is hanging down. If it is contracting, it becomes tense and moves back, and making this particular opening of the mouth cavity and the nasal cavity guarded by it. So, that is the significance of this particular thing. So, whenever you are swallowing, this particular two muscles contracting and covering up the opening of the posterior nasal opening. That is what we call them as choanae. So, if the choana is guarded by these muscles, food particle cannot go to the nasopharynx or cannot go to the nose. If these particular muscles are not working, the food particle may enter into the oral cavity to the nasal cavity. We call them as nasal regurgitation. The patient chokes at that particular time. So, that is the key muscle when this particular muscle are talking about the functions of the palate muscles we are going to talk. Rest of the muscles is equally helping this or anchoring this. So, this particular muscles, if you see that in pictures, they are looking like this, looking like this together, like hanging from above and down. So, palatoglossus and the palatopharyngeus, these are anchoring to these particular muscles which are going down, and these two muscles, tensor and levator valli palatini, anchor these things out. Looks like an English letter H, which is a common meeting point with the musculi uvuli in between them. So, these are known as the palatine aponeurosis, where the muscle ends of the tendon joins together and present in the uvular region. So, they are climbing up and climbing down. These two muscles are giving this anchorage when these particular muscles are contracting and moving back. So, that things stabilizing. So, that on this particular stable front, they are acting like reaching back whenever this particular swallowing act is going on. So, this is how these particular muscles are of the palate are placed in these regions. So, these particular muscles, if they are there, they have to be supplied by some nerves. The nerve supply to this particular palatal muscle is important to us. We have to remember pichon. All the muscles of this particular region of the palate is supplied by this particular plexus. We call them as pharyngeal plexus, which is contributed by the vagus branch and cranial part of the accessory nerve. They are basically innervating these muscles of the soft palate, except one, tensor valli palatini. This is supplied by or developed from the first pharyngeal arch. So, first pharyngeal arch being developed from it has to be supplied by the V or trigeminal mandibular branch of the trigeminal nerve, which is supplying to it. So, all the muscles of the pharynx is supplied through this particular plexus. We call them as pharyngeal plexus. Pharyngeal plexus is contributed largely by the vagus and this particular cranial accessory. So, they are together supplying this muscle except tensor valli palatini over this region. Coming to this particular general sensation and the special sensation. General sensation, that means touch, pain, temperature. If you are taking this particular food, that means hot food, cold food, etc., etc., you are feeling something. So, we call them as general sensation. That is coming to this particular branch of trigeminal, which is taking up this and as well as this glossopharyngeal nerve. So, V and 7 is taking this general sensation in a mixed terms, taking this sensation which is present. In this particular palate, soft palate have got some taste bars present to it. So, it has a taste sensation capacity on this soft palate as well. This taste sensation from the soft palate is innervated by this nerve, which is 7th cranial nerve. That means facial nerve through the nucleus tractus solitarius nuclei seeding this particular taste bars through the facial nerve through the lesser petrosal nerve. They are supplying to it. Coming to the gland that are present in the palate, which are supplied or innervated by this parasympathetic fiber, which is coming from this pterygopalatine ganglions. So, this is about the sensory supply, the motor supply, this particular special supply like in terms of like secretory motor, glandular secretion, and as well as the secretions as well as the taste sensation of the palate is concerned. So, summarily this particular summarily this particular muscles that you have to know the actions and the innervations of this particular each of these particular muscles that you have to understand really well to answer these particular clinical questions. Regard to this particular palate swallowing reflex, we call them as deglutations and regurgitations of the food particle if we have palsy of the pharyngeal plexus. Now, coming to this next entity about this particular deviations of these muscles of the pharynx, we have a fiber, which is present in the palatoglossus muscle, which is arching up over this region, which is going from the palate to the pharynx, which is going down like this. A fiber, which is we call them as like a X-directed fiber, which is present of this palatopharyngeus, instead of the going down, they are climbing up. So, this climbing up fibers said to be running from the uvula and anchoring to this particular part of this particular like upper part of the pharynx, we call them as passavant's ridge. So, passavant ridge is nothing but a directed fiber or muscle fiber, which is coming from the palatoglossus muscle. Instead of going down, a tiny fiber is upper fiber, which is moving up and anchoring to the muscles of the pharynx. Now, what they are making, this right side and left side, they are encircling this particular opening. What opening? We have this choanae present in here. So, this posterior nasal opening present in here, around this posterior nasal opening, we might find a C-shaped fiber formed by the palatoglossal muscle present to it. This particular muscle fiber, if it is present, if it is visible, we call them as passavant's ridge. So, this is about and mentioning about the passavant ridge and the elevated part of the soft palate, which is present on this particular palate and the pharynx. Now coming to this particular blood supply of this particular soft palate is coming from the same source, palatine branch of maxillary artery, facial artery and the ascending pharyngeal artery. They are supplying this particular blood supply to it. Venous drainage coming to this particular venoid plexus, stereoid plexus that we already have mentioned. Lymphatic drainage going to the same thing, which is likewise the hard palate is going, cervical group and retropharyngeal group. Functions of the palate is of course helps in just like swallowing reflex, helps in taste sensation, helps in kind of like protections in terms of like preventing the infections from this oral cavity to move to the nasal cavity, and voice modulations of course. So these are the functions of the palate over there, this particular regions that you have to learn about. Paralysis of the palate, that's what we have to understand, the motor paralysis. So if this particular muscles of the palate is not working properly, that can lead to this particular flap error, which can lead to the nasal regurgitation. That's why we mentioning here. So this particular fluid material instead of the mouth end up into the oral cavity. So this is about this particular hard palate in terms of theory. You have to prepare this. Practical, in practical sessions we already watched it. Thank you.